Hi, my name is Doreen Carranza. I'm a registered nurse, and I have created this brochure just to have a brief overview of the HIV and homeless population, also a vulnerable population to the public health. Here's a brief overview. There's an estimate of 3.5 million homeless Americans each year, with 3.4% of that population diagnosed with HIV. Due to lack of resources for healthcare, high risk for communicable diseases, and nutritional deficits, the homeless population, as well as those living with HIV, are considered a vulnerable population. Homelessness and HIV separately are long-standing public health concerns. Surveys show that lack of affordable housing means sacrificing other basic needs, which may include medications. Many of the homeless are intravenous drug users and share and/or reuse needles, thus increasing the risk for contracting the disease. In addition to intravenous drug use, those living homeless are more likely to have unprotected sex or participate in same-gender sexual acts, also increasing their risk for contracting HIV. There are a list of preventions that I have noted in the brochure. I discuss primary prevention, secondary prevention, and tertiary prevention. Primary prevention is staying healthy before you get sick. What does that mean? You're protecting yourself by staying healthy, seeing the doctor, knowing your resources for medical care for the uninsured and homeless, and going for annual physicals. So meaning, knowing even though you don't have the means, or you may not have, there is help there. And knowing that is the first step in preventing. Secondary prevention, preventing the spread of HIV once it's contracted. This is for the population who already have the disease, and it's just a prevention method of not spreading it to the rest of the population or anyone else. And this could mean by, knowing your resources and obtaining clean needles. If you are a IV drug user, knowing not to share needles. Also practicing safe sex. Tertiary prevention is management and coping with HIV. This is obtaining proper medical care, while you also, I think both of them run hand in hand pretty much, secondary and tertiary. Secondary, you're preventing people from getting it, and tertiary, you're taking care of yourself. You're obtaining proper medical care, taking antivirals as prescribed, and it can even mean attending counseling for those living with HIV. So some prevention techniques that I also discuss, again, are safe sex, use of condoms, abstaining from sex can also be another method, abstinence. Substance abuse programs for those people who have substance abuse problems with IV, heroin, things like that make you more at risk for contracting disease. And again, no sharing of needles. Normally we say sharing is caring. In this case, sharing is daring. You are putting yourself at a huge risk for contracting disease, and if you have it, you are putting others at risk by sharing these needles. And not only HIV, are we talking about, you have hepatitis, you have hepatitis A, B, or C, and HIV. So again, sharing is daring, it's not caring in this case. I have listed also a list of local resources here in New York. We have Care for the Homeless, which provides primary health care services, mental health services. They're located in all 5 boroughs. This is very important between the health care services and mental health services. I think HIV population as well as the homeless need both medical care in order to be screened, tested, and given care for those who, and given medication. Mental health services is a big plus. You know, some people, you need the mental support once, you know, you are diagnosed and with, you know, the situation of, you know, why you became homeless, or, you know, there's help. We also have HASA, which is HIV and AIDS Services Administration. The services for this include intensive case management and assistance in applying for public benefits and services including housing. And their address is also listed in the Bronx with a telephone number where you can reach them. And then we have the Lower East Side Harm Reduction Center. This center provides free harm reduction services to adults 18 and over. They have a history of who have a history of substance abuse, homelessness, hepatitis C, or mental illnesses. And services also include syringe exchange, another big plus. Not that we're, you know, condoning the fact that, you know, IV drug use exists, but we're saying that if you're going to do it safely. There's also case management that can help with housing, with home health services if needed, transportations, things like that as far as for case management. Individual as well as group counseling. This goes for counseling for substance abuse. This is for counseling for individual, again, or group coping with your disease. And they also have referrals. So the addresses is 25 Allen Street, New York, New York. All three have the addresses listed. And also on the bottom of this pamphlet, there is a number. It's given by the CDC. It's called Get Tested. 1-800-CDC-INFO to ask for free testing sites in your area. This number can be reached and you can call anywhere, give your location, and they will give you local testing sites where you can go and get tested. It's important to know, very important. That's the first step. But this is it. And any questions? Feel free to ask them. Thank you.